When people are applying for general surgery residency, especially when they're looking at a certain tier of programs, after a while they all start looking a little bit the same. The big surprise for me was my exposure to transplant as an intern and the level of support and the level of mentorship and guidance that I received. And that just opened a door to something that has been fantastic and spectacular, and a career beyond anything that I could have imagined.
You have a ton of autonomy at Baylor, and I think it's one of the things that Baylor does really well is making sure that their residents learn to be ready to practice on their own in entirety. Really strong support in the form of mentorship and assistance with finding fellowship and jobs that people want.
Yeah, I feel like we had a great experience seeing a high volume of patients all across different specialties, and worked with a lot of tertiary specialists, and just through seeing kind of how they managed patients was able to kind of extend that in this rural hospital that didn't have those specialist surgeons, but because I was familiar with them, was able to go above and beyond what a normal general surgeon in the United States would be able to do. But certainly all of the common general surgery issues, I felt very well prepared straight out of residency.
One of the things that I think is best about that program that you don't see at a lot of others is the variety of hospitals that you train at. There's very good exposure with a county hospital, an excellent level 1 trauma center. You have, the biggest VA in the country. You got an excellent children's hospital, an excellent cancer hospital, a high quality private hospital, and the exposure to the multiple different types of learning environments and multiple different hospitals that you could ultimately join, I thought was one of the best aspects of that program.
I felt very well supported with the group of chief residents I was coming out with. We were a pretty tight-knit group. And so I thought that I had great support from all the faculty there, and I didn't have any issues matching, which I think that just goes to credit what a great place Baylor is.
Training at Baylor is excellent. Both the knowledge and the surgical skills I acquire, they are top-notch. BZM prepared me very well for the variety of surgical cases that I was going to encounter during my practice.
If you want to come in and be trained to be a general surgeon and go into the community to a community hospital and practice general surgery, you'll be able to do that day one graduating from the program here. If you want to follow a similar path to what I did and go into a fellowship, you're going to have an excellent opportunity to basically pursue any fellowship that you would desire from general surgery. If you want to be completely academic, if you want to be completely private practice, if you want a hybrid, I've seen people be able to excel in all of those. And I think that something that you might not always appreciate as a trainee is that some programs or some residents have the experience that they're being pushed in one direction by their faculty, or maybe don't feel supported if they choose to go from a very academic environment to a private practice environment. I never once felt that was the case. I felt that everybody that went to private practice was well supported, and everybody who went to a more traditional academic route was also very well supported.
That's very difficult to get into surgical residency, especially to a prestigious residency like in Baylor College of Medicine. But it's possible as long as you decide what you want to do and go for it.